Your feet may be touching the floor right now, but imagine that the floor is slowly disappearing, not from the room, but from your nervous system. At first, it is easy to ignore. A faint tingle. A sock that seems bunched up when it is not. A strange patch of skin that feels slightly less alive. Then one day, you step on something sharp, or the shower water is hotter than expected, and your feet barely warn you. So why would the body begin switching off sensation in the feet first? The answer is not that your feet are unimportant. It is almost the opposite. Your feet sit at the far end of one of the most extraordinary communication systems on Earth, the peripheral nervous system. And when that system is under stress, the longest communication lines are often the first to fail. Before we follow that signal all the way from your toes to your brain, subscribe to the channel. Because the quietest changes in the body often reveal the biggest stories. First, we need to destroy a common illusion. Many people think numbness means blood has simply stopped reaching the foot. Sometimes reduced circulation can contribute to abnormal sensations. But persistent or gradually spreading numbness often points to a problem in the nerves themselves, or somewhere along the route those nerves use to communicate. Think about the last time your foot fell asleep. You sat awkwardly, crossed your legs, or placed pressure on a nerve. For a few minutes, the signal became distorted. Then you moved, the pressure lifted, and sensation returned. That temporary pins and needles feeling is common. Gradual loss of sensation is different. It may keep returning, affect both feet, begin in the toes, and creep upward like an invisible pair of socks. It may tingle, burn, or feel like electric shocks. Sometimes the most dangerous change is simply less ability to feel pain, heat, cold, pressure, or the position of the feet. Have you ever felt unexplained tingling in your feet? Type yes or no in the comments. To understand why the feet are often first, picture your nervous system as a countrywide electrical network. Your brain and spinal cord are the central control station. The peripheral nerves are the cables running from that station to every patch of skin, muscle, organ, and joint. The nerves reaching your toes are among the longest in your body. A single nerve cell can extend an astonishing distance compared with its microscopic width. It is like maintaining a fragile power cable that runs from a city center to a remote village hundreds of miles away. The farther the destination, the more cable must be powered, repaired, insulated, and supplied. That length creates vulnerability. Every nerve cell has a long extension called an axon, which carries electrical information. Imagine a railway transporting messages instead of passengers. Materials must move outward to maintain the distant end, while damaged components travel back toward the cell body. This internal transport system is called axonal transport. The term sounds technical, but the idea is simple. It is the nerve's delivery service. If energy becomes scarce, toxic stress rises, or the transport machinery is disrupted, the most distant part of the route may struggle first. In link-dependent polyneuropathy, damage commonly begins at the ends of the longest nerves. That is why symptoms often start in the toes, then move through the feet and lower legs, and may reach the hands only later. The pattern is called stocking and glove loss because sensation fades in those areas. The body is not deliberately shutting down the feet. The farthest nerve endings are simply the hardest to maintain. Now zoom in farther. Your skin contains tiny biological detectors called sensory receptors. Some respond to pressure, vibration, temperature, or potentially damaging events. When you step on a rough surface, they turn physical forces into electrical signals. Those signals travel toward the spinal cord and brain, which combine them into an instant map: hard floor, cold tile, uneven ground, sharp object. Beneath one simple sensation is a storm of coded electrical activity. Nerves do not merely send feeling. They send different categories of information through different fibers. Large, fast fibers help carry vibration, touch, and position signals. Smaller fibers carry pain and temperature information. Depending on which fibers are affected, one person may lose vibration sense and balance, while another develops burning pain or reduced temperature awareness. That is the first strange twist. Damaged sensory nerves do not always become silent. Sometimes they become noisy. A damaged wire may stop transmitting, but it may also crackle. In the same way, an injured nerve can produce tingling, stabbing, burning, or shock-like sensations even when nothing harmful is touching the skin. The system designed to report danger begins creating false alarms. Later, if more fibers fail, the noise may fade into numbness. This is why pain and numbness can exist together. One patch of the foot may feel deadened, while another feels painfully sensitive to a bedsheet. It sounds contradictory. Neurologically, it is not. Different fibers can be affected at different times and in different ways. Now we reach the question everyone asks: what causes the damage? There is no single answer. Peripheral neuropathy is a broad name for damage affecting nerves outside the brain and spinal cord. Diabetes is a common cause. Over time, high blood sugar can damage nerves and the vessels that nourish them, like a cable and its supply route being harmed together. But diabetes is only one possibility. Nerve problems may also be linked to vitamin deficiencies, thyroid or kidney disease, autoimmune conditions, infections, inherited disorders, injury, nerve compression, heavy alcohol use, or certain medicines. Sometimes no clear cause is found. This matters because numb feet are not a diagnosis. They're a clue. A compressed nerve in the back may send numbness down one leg. Pressure near the ankle can affect sensation in part of the foot. A systemic condition may affect both feet in a more symmetrical pattern. Sudden numbness has a different meaning from numbness that develops slowly over months. Weakness changes the picture. So do balance problems, back pain, skin color changes, wounds, or symptoms elsewhere in the body. That is why guessing from a video is risky. A clinician may examine reflexes, strength, balance, skin, pulses, and the exact map of numbness. Blood tests can look for treatable causes. Nerve conduction studies test how signals travel through a cable-like nerve, while electromyography assesses electrical activity in muscles. If this deep dive is changing how you think about your feet, subscribe now. We're about to enter the part where a tiny sensory failure can trigger a much larger chain reaction. Here is the dangerous misconception: if numbness removes pain, perhaps it is a relief. But pain is not merely suffering. Pain is surveillance. It is the body's alarm system. It tells you to lift your foot from a hot surface. It makes you change your stride when a blister forms. It forces you to inspect an injury. When sensation fades, the threat may remain while the alarm becomes quieter. Imagine a small pebble inside a shoe. A person with normal sensation feels it quickly and removes it. A person with reduced sensation may walk on it for hours. Pressure repeatedly hits the same point. The skin breaks down. A blister or wound forms. But without a strong pain signal, the person may not notice. Now add poor healing or reduced blood flow, especially in diabetes. A tiny injury can become an infected ulcer. The danger emerges from a chain: reduced sensation, unnoticed trauma, delayed treatment, and impaired healing. This is why daily foot checks can matter for people with reduced sensation, particularly those with diabetes. Look at the tops, soles, heels, and spaces between the toes. A mirror can help with areas that are hard to see. The goal is not to become afraid of every mark. The goal is to replace missing sensory information with visual information. Which warning system would you trust more, pain or sight? Type pain or sight. Temperature is another hidden danger. If heat-sensing nerves are impaired, bath water may feel safe even when it is hot enough to damage skin. Heating pads, hot water bottles, radiators, and hot pavement can become risky because the normal move-away signal arrives late or not at all. Testing temperature with a numb foot is like testing a smoke alarm after removing its batteries. Balance may also change. Your eyes are not the only tools keeping you upright. Receptors in muscles and joints tell the brain where your feet are. This sense, proprioception, is the body's internal global positioning system. It lets you know your ankle's angle without looking. If those signals weaken, the brain receives a blurrier map of the ground. Walking may feel less stable, especially in darkness, when vision can no longer compensate. A person may watch the floor more closely, widen their stance, or stumble on uneven surfaces. Muscle weakness can add another layer. making it harder to lift the front of the foot or control each step. And then comes escalation. Suppose damage continues unnoticed. Numbness rises toward the ankles. Balance declines. A wound appears beneath a callus. Without pain, the person keeps walking. Pressure deepens the injury and infection spreads. Microscopic nerve damage has now changed movement, skin, and safety. Or imagine the opposite. The numbness appears suddenly, on one side, with weakness, facial drooping, confusion, trouble speaking, severe dizziness, or a sudden intense headache. That is not the slow pattern we have been describing. Those can be emergency warning signs, including signs of stroke, and they require immediate emergency help. Rapidly increasing weakness, difficulty walking, numbness spreading upward over hours or days, trouble breathing, or loss of bladder or bowel control also needs urgent medical assessment. A cold, pale, blue, or severely painful foot can signal a circulation emergency. A deep wound, spreading redness, swelling, pus, fever, or a blackened area needs prompt care, especially when diabetes or reduced sensation is present. Not every tingle is an emergency. Brief episodes caused by posture often resolve. But pattern, speed, symmetry, and accompanying symptoms matter. Gradual numbness deserves attention too. Early assessment may uncover something treatable, such as a vitamin deficiency, medication effect, nerve compression, or an underlying metabolic condition. Even when nerve damage cannot be fully reversed, treating the cause may slow progression, and practical steps may reduce injuries and falls. Do not start large doses of vitamin supplements simply because numbness exists. More is not always safer. Excess vitamin B6, for example, can itself damage nerves. Supplements can also delay the search for the real cause. The useful move is not random treatment. It is accurate diagnosis. A clinician may ask questions that seem unrelated. How long has this been happening? Both feet or one? Toes first or the entire leg? Worse at night? Any back pain? Any weakness? Any recent medicine changes? Any history of diabetes, thyroid problems, kidney disease, stomach surgery, restricted diet, or chemotherapy? Each answer changes the map. The examination changes it further. A tuning fork checks vibration. A soft filament tests protective sensation. Reflexes and strength test nerve circuits. Pulses and skin temperature offer clues about circulation. Together, these create a pattern. And patterns are everything in neurology. Think of numbness as a broken streetlight. One dark lamp may mean a damaged bulb. An entire row failing from the farthest end inward suggests a problem in the power line. Half the city going dark suddenly suggests something else entirely. Doctors do not only ask, is there numbness? They ask, what shape does the numbness make? The shape can separate a local nerve problem from a widespread neuropathy. The timing can separate temporary compression from progressive disease. The additional symptoms can point toward sensory, motor, or autonomic nerve involvement. Autonomic nerves control automatic functions such as sweating, blood pressure, digestion, and bladder activity. If they are affected, numb feet may be one part of a larger story, telling clinicians where else to look. So, what can a person do while arranging medical advice for persistent numbness? Protect the information gap. Check the feet. Wear well-fitting shoes. Inspect the inside of shoes for stones, rough seams, or folded material. Avoid walking barefoot when reduced sensation makes injuries harder to detect. Use warm, not hot water. Dry carefully, especially between the toes. Do not cut corns or calluses yourself. Seek professional care for wounds that do not begin healing. For someone with diabetes, keeping blood sugar within the target range agreed with their healthcare team is one of the most important ways to help prevent or delay further nerve damage. Regular foot examinations can detect risk before a serious complication develops. Smoking can reduce blood flow to the feet, so support for stopping matters too. For everyone else, the principle remains: treat the cause, not just the sensation. A numb foot is not asking for a louder alarm. It is asking why the alarm circuit is failing. If you want more explanations that turn silent body signals into clear stories, subscribe before the final twist. Here it is. The feet do not lose sensation first, because the body values them least. They often lose sensation first because they are neurologically farthest away. Every step depends on a communication journey that begins at the ground, races through some of the body's longest nerve fibers, enters the spinal cord, and becomes a conscious map inside the brain. You call it feeling the floor, but it is really a continuous long-distance data transmission system operating faster than thought. When the farthest edge of that system begins to fail, the brain may receive less reality. That is the mind-bending part. The floor is still there. The pressure is still there. The heat, the blister, the sharp edge, and the slope are still there. What disappears is the message. That silence can be the first visible clue that a larger process has already begun elsewhere. And when a message disappears gradually, the brain can adapt so quietly that the person may not realize how much information has been lost. They do not feel numbness as an active event. They simply stop receiving details they once received automatically. Your sense of the physical world is not produced by the world alone. It is produced by signals about the world. Damage the signal, and reality itself seems to change. So tonight, pay attention to the farthest part of your nervous system. Not with fear. With curiosity. Notice whether both feet feel the same. Look for injuries you may not feel. And if numbness is persistent, worsening, or joined by weakness, balance problems, or wounds, arrange medical care rather than guessing. Because the first system to go quiet may also be the system trying hardest to warn you. And if the nerves in your feet can change the reality beneath every step, what other silent sensors are shaping the world you think you know?